The purpose of this is to show you what we think is the optimal injection technique for the dorsum of the hands. As we improve the aging of the face, it's important for us to be able to offer options for the neck and the décolleté and especially the hands. So in my practice, and I think in most of the experts' practices that are here, the consensus opinion is that the Radiesse is the superior product for dorsal hand improvement. What I do in the form of consultation with the patient, as I've done with Maureen, is advise her that there is a very good probability that she's going to have some soreness and some swelling of her hands, and make sure that that is okay with whatever their social or work schedule might entail. What I've already done in order to save time was we did a topical anesthetic so that she wouldn't feel the stick. And as you can see, this is a 22 gauge needle that I've made as the insertion point. So what I like to do is take this out. And the hardest part of this is making sure that you can find where you stuck your needle. Now, I am doing injecting a little bit as I advance because it gives me a sort of like a plane in which to get the next injections. And what I want you to see is using the Mertz cannula, do you see how it's bouncing off of the vessels here? And this is actually way back when I decided to begin using the cannula and using Radiesse in the particle fillers in the temple area, and have found that if it bounces off these blood vessels, it'll bounce off those blood vessels too. So what I'm going to ask Maureen is, how is this feeling, sweetie? Fine. All right, so she's a good patient. In the interest of time, I am going to do one side on camera. So if there's any burning questions, just go right ahead and go up to the mic, and I'll be happy to answer them.
Mary, did you say that you used a one-to-one blending of the Radiesse?
That's what I do.
And then how frequently do you get significant swelling of the hands post-treatment with Radiesse?
Pretty significantly. I manage it by telling my patients ahead of time that they're going to get it. And I'm going to have her sit on her hands when I'm done. I think that's going to help. I'm going to tell her to try to keep her hands up as much as she can today and do some other counseling like that. But I mean, you can certainly give them a Kenalog shot. I think that would probably decrease some of the swelling, but you know, I don't think swelling is necessarily a bad thing. Do you feel strongly that you need to address the swelling with a Medrol dose pack?
Well, I've had people get extremely swollen, but I haven't blended the Radiesse as much.
So you're using like a 0.5?
Yeah.
Yeah, you know, I really have...
Hey, Mary, I think this is Rod. I think the best thing with hands is keep them elevated for 24 hours.
I really think that's the
most
best
thing. You know,
way.
I'm actually a hand surgeon as well, so keep them elevated. Hands like to be elevated after you traumatize them. So elevation, and then I have them sit on it while I'm doing the other hand.
Exactly.
And then I elevate them for 24 hours. You can put ice on them. And I ace wrap them lightly, not compressive, and they actually will have minimal swelling them, but you got to keep them elevated for 24 to 36 hours. And the other thing is, do you ever do bolus injections? Like sometimes
I used to do it that way. I used to do, in fact, I did a hand demonstration years ago with Radiesse on the stage before I was using cannulas. And I called it the matzo ball technique.
Matzo ball.
And what I did was I would do the little, and I was doing it with a needle. And so I didn't want to do this with a needle. No. So I did the little matzo ball technique, and then I would mash, and it was wonderful. Yeah. But this is so atraumatic for patients. And you can really, see, with the 2-inch, I'm getting way over here.
Yeah. Do you do a separate stab for the first web space?
You know, I don't worry that much about these. I try to massage it over into this area. I am a pretty vigorous massager.
Yeah, that's good.
So I used 1% lidocaine with epi. But already, if you put the hands side by side, you can begin to see the purpose of this is to camouflage the very noticeable tendons and veins so that the hand looks plump. So what I'm going to be doing today is I'm going to do 1 syringe to each hand. Sometimes with a conservative patient, I might do a half and then have them come back in 4 weeks and do another half. You doing good?
Mary, it's Kenny. I got 2 questions for you. How frequently do you combine this with a resurfacing or peel? And the second is, how come you do proximal to distal and not the other way?
Oh, you mean do the insertion here and go this way?
Yeah.
I don't know. Why do I cook my gumbo with andouille sausage instead of smoked sausage? I mean, it's like anything else. I think it's just what you're used to doing.
Okay.
I think I can hide the dot here really well. And I've just found that if following the spread of the tendon, I just find it's easier to get the material if I start here than I start here. I feel like I have a little bit more drag when I go the other way. It's amazing. I think you can really, once you get that plane, you can really spread it out.
I think it's ironic we've gone from matzo balls to sausage.
I know. You know, I'm from New Orleans. Everything is a food analogy, okay? Now, the other thing that I've been asked to reiterate is, because I mentioned it a lot in the cadaver course, is, you know, I do a lot of lateral face fill, and one of my other favorite uses of Radiesse is in the post-facelift patient who has that bound down skin, and I love using a cannula, and I fan and I'm subcising that scar tissue. So what I'm doing is I am doing a vigorous massage upward like this, and I'm pretty strong with my massage, and then I'm going to take my Cytoactive, my anti-bruise product, which also helps me glide and feel for any lumps or anything or any accumulations. You doing all right? All right, and we're going to do the other half off stage because I really want to keep on time. But before we have her sit on her hand for a second, we'll just do a comparison, and then you can see how much better the hand looks. I usually tell people that I want them to do 2 to 3 sessions over about a 6-month period, and I usually have them come back and do the second one at about 6 weeks. Much the same as I would do if I were doing my Radiesse or Sculpture plan.
So it's one syringe on each hand,
Yeah, not necessarily, but that's what I usually start with, and that's usually what they end up by needing is about 2 to each side. Okay?
Okay.
All right.
Very good.
Thank you.
Very much.